Molecular medicine is a reflection of the evolution of medicine. If we go back a generation or 2 generations ago, people who were practicing medicine at that point would have said they're doing precision medicine. And that is because medicine is constantly evolving.
It is very important that we implement precision medicine everyday care, not simply to select for a clinical trial. It's very important that we do this early on.
We already know that this is one of the key defining moments in the fight against cancer. This is a rapidly evolving field. It evolves by the week, not even by the month.
When I was training, CT scans and MRI scans were just becoming available, and that gave us a more precise way to evaluate patients and their disease. So the molecular assays that are now being utilized to help in decision making are just a continuum of that evolution of medicine.
With precision oncology, what we do, we identify specific targets within patients' cancer, and we try to target those specifically.
So it's not only a personalized, trying to understand the tumor, but also trying to individualize to the particular patient that we are treating with the specific disease.
We came up with the name OncoSET, so it clearly reflects a process that we have in place.
Onco stands for oncology or cancer.
SET, S-E-T, stands for sequence, evaluate, treat. Sequence, go and analyze the genomic composition of tumors. Evaluate, we have a molecular tumor board that reviews this information, and then we obviously try to bring it to clinical care to treat, either as standard treatment when they are available, or as participation in tailored clinical trials for a specific molecular abnormality.
Finding out the genetic changes of a tumor is a last stage thing, is a myth. In fact, many of our disease nowadays, their basic classification and treatment is defined by their genetic test.
The idea is that very early on, to understand which category of disease are we dealing with a baseline molecular test, and then our ability to monitor over time to put these different treatments and options in a sequence.
The minute you find out you have nodules in your liver, it's a death sentence. Having the Guardant test enabled, it changed my treatment twice. The simpleness, and it's so exact. I didn't have to go through painful biopsies and long tests like MRIs and things like that. And it gave my doctors so much more information. I am 80 days into my treatment. I just had my repeat PET scan, and the nodules are showing a rapid response and very little metabolic activity on the PET scan. Whew, sorry. It's a new chance. I want this treatment. I want more time, and it's giving me that. Everything that you want as a cancer patient, you're going to find out that there's what your options are, and there's going to be a lot more options available to you.
With these tests, we get a lot of information. Every tumor that we sequence, there are several different mutations. And it's often challenging for oncologists to figure out which one of these targets are more important and which ones are the ones that they should be going after.
We have a molecular tumor board, which in addition to the standard tumor boards that have surgeons and medical oncologists, radiation oncologists, also include experts to help us analyze the genomic information.
And what we do is we try to demystify the result of the genetic testing relevant to patient's tumor to make recommendation based on these test results.
I think this affords the opportunity clearly for those in the community that don't have access to this is to determine whether for their patients with a specific malignancy there might be something unique outside the realm of standard of care that can be provided to their patients, or at least offered to their patients, that give the prospect of a better outcome than standard of care therapy.
I mean, this is life and death. You know, they started out with, well, okay, this is the standard treatment, and we'll give you this, and then we just move on to the next one, and the next one. Then we ended up with the molecular testing. And then with that, new treatment options opened up for me, and they would not have been available to me otherwise. You are actually targeting the source of the cancer. You're just not, throwing something out there and hoping it sticks. Once you hit that magic mark, like for me personally, I think I've hit it because I have a very high quality of life, and I really believe with all my heart that if it wasn't for this genetic testing, that I would not be here. I absolutely am convinced of that.
All tumors are very different from each other. So that's what the OncoSET is trying to accomplish, give specific treatments for the specific tumor of the patient.
We think and we hope that we'll find that these kinds of tools not only are available to physicians, but transform the way we take care of patients.
The efficiency of precision medicine is not a hypothesis or a belief of us only. It's well proven in the literature that precision medicine is more effective and saves lives.
I think this is becoming so much of an urgency from the patient point of view that we do have a responsibility actually to learn, collaborate, and as an organization, I think, come to implementation of this test in practice every day.